Hey, boo-boos. Hi. Hi, my love. Hi. When he stopped breathing and turned blue and didn't move, I thought he was in cardiac arrest. I was terrified. I was home alone that day with him. I remember slapping his chest, trying to get him to wake up. He wouldn't respond, and that's when I put him on the floor, and I started doing compressions to bring him back, and it took probably a few minutes for him to start breathing again. By then, I had managed to dial 911. I felt like our world kind of crumbled in that moment because we were so hopeful that maybe he didn't have brain malformations.
Here, can you put Flo in the bag? Thank you.
Can we drop some Ativan? Did we get an IV?
No, May just got here and you guys still don't have Flo in the bag.
I went in for a routine prenatal visit, and the doctor listened to fetal heart tones and noticed they were very rapid. And that began a cycle of a number of diagnostic imaging where they realized he was in distress, in respiratory distress and cardiac distress. And it was that same day that I ended up having an emergency C-section.
There he's back.
He just got his color.
Okay. Okay.
Yeah, I mean, he's coming out of it now.
Okay. All right.
It was, everything was uncertain and unclear, and there were no answers. The answer to everything from every expert was, we don't know.
His genetic syndrome is called linear nevus sebaceous syndrome. It's also known as Schimmelpenning syndrome. It's usually, it manifests as unilateral, meaning one-sided malformations of a number of body systems. So it's usually the brain, the eyes, the heart, kidneys, liver, bones, and skin, which he ended up having all of, actually, all on his right side. Looking back, once he was diagnosed, it made sense because all of his skin malformations, his velvety patches, were all on his right side. He seemed relatively normal, though at the time we were still feeding him by NG tube. It's a nasogastric tube, so a tube that went into his stomach. It was just scary taking on the new norm, but it quickly evolved into, okay, so he gets sick a lot, and we feed him via tube, and that's just normal. But it was after 2 total months in the NICU that he was finally able to go home. In terms of the brain malformations, that didn't end up showing itself until 3 months later after he was discharged from the hospital. It is very difficult to recognize infantile spasms. So most families don't recognize infantile spasms until they are full-blown spasms, meaning they've likely been happening for months and increased in severity to now they're noticeable. 5-month-old baby doesn't know how to wink. And it was specifically one eye, and it was still seeing that same neurologist who was not a fan of epilepsy surgery, and she said, well, he's just winking.
This wink went from initially just one eye closing periodically to one eye closing in clusters of 5 or 10 or 15 times in a row. Then the wink became more pronounced, so there would be like an actual scrunch on the side of his face, and then it eventually progressed where his arms and legs and his head joined in as well, which is more of like the textbook sign of an infantile spasm, where the hands come in and the shoulders shrug and the head kind of goes to the side.
The epilepsy journey is very difficult once you start on medications because usually one medication doesn't work. You have to add a second one before you wean off the first one. Then often you're adding a third as you wean off the first. And so our child became a version of himself that we never thought we would come to know.
Ezekiel. Ezekiel. Hi, boo. Hi! Hey, big boy!
His life consisted of, a number of medications in the morning and afternoon and the evening, and then going in for EEGs. So those are when electrodes are placed on the scalp and the electrical activity is monitored over, a period of time. We noticed that he was not happy, that his development stalled. So he stopped having the apneic seizures where he stopped breathing, but then he started having infantile spasms, which is a more catastrophic form of epilepsy. And so we were counting seizures per day, counting clusters, keeping a journal.
It's 4 o'clock. This is the second one in an hour.
A family member would stay awake with him all night because he would be asleep, wake up and start to seize. So we want to make sure he didn't stop breathing and that we were there to provide extra support. We were just on all the time. There was no break. There was no respite ever. I felt hopeless in that time. And all of these emotions are swirling while he's having a seizure.
Maybe? Peekaboo!
Sure, I've been a nurse for a long time, but this was very different. This was very personal. This was just catastrophic for me. But there's a helplessness with epilepsy.
Yeah.
You're just watching your child seize, and there is nothing you can do about it. You're giving them all the drugs that physicians have prescribed, and you still watch them seize themselves into oblivion.
Okay, yeah, so put your finger and fall down and take it, so you can see through there. Yeah. Another focus.
It happened again.
Things were getting worse, not better. He was devolving into just, by the end we were counting 500 or 600 twitches a day. And so he'd just be kind of staring and then would start twitching 40 or 50 times in a row.
His first neurologist, her actual words were, if you touch this baby's head with a scalpel, it would be criminal. Yeah. I was horrified at her response and the dismissiveness of her response.
We just left and never went back.
Like right now I'm thinking getting through college and graduating from Pitzer, which is going to be crazy, like a crazy thing to have done as someone who's had a hemispherectomy. It doesn't happen a whole lot of the time. My first ever seizure was a grand mal seizure, and that happened to be my only ever grand mal seizure, which is very lucky. Happening constantly, and that essentially means I was having no physical feelings on my arms or legs or my face, any part of my body, but inside of my brain was constantly seizing, and that the doctors, the technicians, everybody was amazed that I was walking, talking, playing sports like I was at the time in 6th grade. I had multiple brain surgeries to essentially cure drug-resistant epilepsy. We're creating a documentary on epilepsy, in particular like hemispherectomies, which you probably have heard about in other psych classes, like split brain, all that.
And then we also covered cyclothymic disorder, which, if you remember, is kind of a disorder that is in which there's alternating periods between more mild depressive symptoms and more mild hypomanic symptoms.
Yeah. Her a hot minute ago, and then I was real busy the past few days with Disneyland primarily.
How are your classes?
Okay, I will see you later. Bien.
Posible. 1, 2, 3, 4, 5. Diferencia entre un mural y un graffiti.
Pienso que una gran diferencia es las murales típicamente planificadas y graffiti es vandalismo.
Okay.
Okay, I don't need a parking permit?
No. You're a visitor. They don't care. Are you crying?
No.
Yes, you're crying.
Oh, no.
I can tell. My room is a mess.
I know. I'm going to clean your room.
I know you are. Thank you.
She had to move last minute, and I
Ew.
told her that I would come up and help her clean. just because I'm the nice mom.
So I think the most important thing is getting everything out of the cart so we have space in the room. How do you feel about that? Here, I think.
Your reading glasses.
My blue lights, fake glasses, so I look smart. Throwing all the trash in the recycling bin right now because I don't have a trash bin for the trash yet. Trash. Oh, those are new. Those are nice and new. It's my farmer's market money.
I know.
I know exactly where it is because it's on my desk. So smart of me, right? It's when you go, yes, Caitlin, so smart.
You're very smart, Caitlin.
Thank you.
There's only a handful of kids that that we've met that can remember before and after.
I really have any strong memories of that morning other than being incredibly tired and being like, I wish I could eat breakfast, but...
Having your daughter, I don't want to say be normal because every kid is normal no matter what they go through, but she was a perfectly fit 11, 12-year-old kid who basically played basketball 6 days out of the week, was very athletic, to have a surgery that she can't do that anymore. That's what's hard. I mean, that's what's hard for her, and I think for a lot of kids who go through this, so you don't have the ability to run. The sports is pretty much
what I miss.
What she misses, because she was very athletic. You mourn that, but yet she's also a person that you aspire to be. Because but it's like she's an inspiration to a lot of us. It's like you never say you can't do something because you can. Never say never.
She cries at everything.
It's just she's gone through so much.
It's okay. Jesus Christ.
Okay. How about under there?
I'm not putting the desk on that wall.
No,
It's
but
too
you
much.
can use the outlet and bring it over here.
How are you?
Good. Let me get my shoes.
Aw, cutie. I think we're gonna get. Can you drop us off at the Starbucks? That's where we're gonna
Wherever
meet,
you want
Mom.
me to start, wherever you want me to drop you off, I'll drop you off.
So, people ask me lots of different questions in regards to my disability. I don't get a lot of questions on the brain itself from like passerbyers, but like definitely by my friends or classmates. I will, just being a psych major, I will get questions like how. No one outrightly will ask me, how do you do that with only half a brain? I think a lot of people, which is really nice, give me the benefit of the doubt and presume I can do everything they can. So I just kind of stick it in there like that mostly at the time, because the hand kind of, I do my best to not let it curl up, but that's kind of its like default position, unless I'm like really actively trying to have it not be. See, there we go. All done. Oh, did I just put the, oh my gosh, I'm gonna look crazy. There. And now, put it away. Like these types of ones, I normally will ask for help, or I'll sit down and just kind of go at it for like 20 minutes. Yeah, this one, oh, I got it. Yeah, I hold this type of stuff between my legs normally, or I normally will also sit down to do it because I just have a little bit more control over stuff then. None of these other things really require too much help. It's very easy one hand. You go like that, close it. Same thing for my hair stuff. Just go like that, it's a little sticky. So now I will normally like have to put my arm, and then I jump, almost fall over, and then I swing my legs up and around. Funnily enough, my biggest challenge, I would say. So I can't put my hair really in ponytails or up in many ways because like, you need one hand, more than one hand for a ponytail, and like, so I kind of just have defaulted. I asked my boyfriend to do it, or anyone who's willing to help me out a little bit, because it's just real hard with like thick, curly hair to get it in a ponytail. It's near impossible, I would say. Only comb it wet because it'll get too frizzy otherwise, and that is not good for anybody, I would say. I like to wear lots of rings. Do my best to keep them there so I don't lose them. Keep it like in my finger and then take it, slip it on my finger. What the hard part is like getting it all the way down, so I've kind of just used my hip and slide it there. We'll keep that one. That was pretty.
Okay, show me where you can't see it on your right. Take it to the farthest point to your right. Okay?
There.
There. Now, bring it towards me. Towards me. Towards me. Towards me. Towards me. Towards me. And when does it blank out?
The finger there, but like I can see the
Perfect.
front of my arm and everything. And then to unzip, just do that.
Okay.
Super easy peasy. And it probably is fine.
Come on, buddy.
Go ahead.
1, 2, 3.
Good job, Henry.
You got it, bud.
Turn
Good
around. Job, Henry. Good job. There you go, Henry. You're home.
Yay. All right, thank you.
You're welcome.
Bye. Have a good day.
Good job, Henry. See you tomorrow.
Let me rinse it. Let me wash it. Let me wash it. It was on the floor. All right, hold on. First night, my husband slept in bed with me at the hospital, and Henry was in the bassinet. It was about midnight, 12:30, and I heard a sound. And I remember from childbirth class, they said, oh, you'll hear the baby, they want to nurse. That's the sound that they make. And I thought, oh, well, I guess it's time to nurse him for the first time. And so I got him out of the bassinet and I sat in a chair in front of the sink in the room, and there was a fluorescent light behind me. And I remember the memory is so vivid that I can almost taste the fluorescent light. I held him up to my breast and his eyes started blinking so rapidly and asynchronously, like he was a robot that was short-circuiting, just each eye. But I've never seen anyone's eyes blink that fast. And I just remember thinking, that's not right. So I called the nurse in and I said, there's something not right, the baby's blinking. And she says, oh, honey, you're tired, don't worry, you're a new mama. We're gonna take him to the nursery, why don't you get some rest? And I didn't think anything of it. And then 1 hour later, I had fallen asleep. The doors blew open. Nurse came in, doctor came in, and they started asking me questions. Did you take drugs during your pregnancy? Just bombarding me with questions. And I just remember I was barely waking up. No. He had a seizure. He had another seizure. So we've given him phenobarbital. It was very accusatory. What did I do to make my son have seizures? So the next 4 days were blurry. So they took him in for a CT scan. And they came back and said it looked like he'd had a massive stroke. That one side of the brain was dark. And I just remember, I didn't know children could have strokes. It was really terrifying. Then they did an MRI and said he had something called hemimegalencephaly. I didn't know what that was. And I remember my sister-in-law said, just don't worry, I'm going to research it for you. I called her, she said, don't look it up. Don't look it up. So of course I looked it up. And when you start to go down the rabbit hole of research, the research was very grim for kids with his condition. It was a massive unilateral brain malformation. And a hallmark symptom of it is uncontrolled seizures. I still hadn't talked to a neurologist yet, and the nurse came in. Gosh, it was late, 11 o'clock. She was young. She was so sweet, and gosh, she came in and she said, the neurologist is here, the neurologist is here. He's in the NICU, the neonatal intensive care unit. He had had a little tube put down his nose to feed him. He couldn't nurse, he couldn't suckle. He was having a lot of seizure activity. His oxygen was dropping, and my Vicodin was wearing off. I just remember walking to the NICU, and the neurologist was an older man, a well-known in the area. And I said, I'm Henry's mother. Can I sit and talk to you for a moment? And he just turned around and he looked me in the eye and he said, your son will survive, but he will never be normal. And he walked away. I just stood there by myself. It felt like hours. I'm sure it was only just a few minutes. The next day, the neonatologist came in and explained to me a little bit about the brain malformation that my son had, and said he's going to have half his brain removed. It's a procedure called a hemispherectomy. I just remember thinking, my God, is he going to know who I am? He's better than he would have been if he hadn't had the surgery. That's loud. What do you want, buddy? Why don't you tell me what you want, pal? Show me what you want on your iPad, pal.
Oatmeal, pizza, hamburger.
Some chips. You can. I'm not going to have a hamburger right now, Henry. Appropriate to get him where he is today. I know when you meet him, you know, it's not the movie star ending, the movie ending, the Hollywood ending that you want, but it's who he is. He recognizes his brother, recognizes his dad. He'll look for me out in public, but he does have substantial intellectual challenges. He's very happy. He doesn't know people think he's different. He doesn't know other kids don't want to play with him. He's happy doing what he does, and I can't think of a better outcome. You know what I mean?
The Challenger League is for kids and young adults who have challenges interacting with a normal sports activity, and this provides an opportunity for them to be themselves and just have fun out on the field. I was born and had half of my body be basically paralyzed, so I can't use my left side very well, and I have a harder time holding things, especially that are big, with one hand.
You don't wear a mitt?
No.
No.
Yeah, because I can't open my hand all the way.
Oh, okay.
So yeah.
But you enjoy baseball?
Yeah.
Oh, that's great. Yeah. Are you going to college?
Yeah.
Where do you go?
Well, I'm. This is my first semester. They've just put a blockade up.
Yeah, so that means he can hit.
Big hitter. That's coming right to me.
Got it. Yeah, oh!
Take the ball. Here it comes. Go get the ball. Whoop! The ball, Skylar. There it goes. And now you throw it to
get
Julian.
a next
Julian. Oh, not to Sammy, to Julian. But that's okay. You did a good job. You did a good job.
Bend down. Get your dookie down there. And when the ball comes, scoop it up in front of you. Step up and throw it over to first base. You got it? Okay, go for it.
Ready? Here it comes.
Yeah.
Got it.
That's it, get it.
Now throw.
Send it to third.
Right.
That's good. Good job.
Nice throw. Here it comes. You ready, Skylar? You're going to receive the pitch again. All right, here it comes. Here it comes, Skylar. What's on second? I don't know.
No, it's who's on first, what's on second. I don't know who's on third. And then
Third, though. I know who's on third.
And Ian, don't forget.
I don't need a helmet.
Ian won't
You don't need a helmet. Your head's that hard, huh?
Yeah.
We got another tough guy here. Thanks for playing today.
Yeah. Here you go.
Thank you.
All right, let's start with some off the tee. Nice hit. What's your name again?
I'm Bennett.
Bennett. Nice to meet you.
Good to meet you too. Nope. Heads up.
Did you bat?
I batted.
How'd you do?
I almost took him out.
Really? How did he feel about that? Did he survive or
He
was he
survived,
nervous?
yeah.
Or... Want me to hold it?
Yes.
Or you want me to put stuff on it?
If you would actually put stuff on it.
I don't know.
All right. I can hold it. Yeah.
You want a little
You have a roommate or are you by yourself?
I have a single this year.
No, you seriously? This is your first year in college? You have a single?
Because of her.
Your mom scammed it. Yeah.
I didn't scam anything. I requested an ADA accessible room.
Mike, move over here.
2, 4, 6, 8. Who do we appreciate? Landis!
I love you guys. It was a great season. You guys did good.
Really? Did they not order?
No, it's not meant for me.
Right there. And then, yeah, right there is where I want you to lean. And lean with your back against the A. So bring that shoulder back, right shoulder back. Yeah, there we go. Oh, it looks so good. I didn't see it with the poster up because it fell. That looks so great.
From the dining hall. It's.
Oh, let's
it
bring this
has-
home too then. I want to take this home and this home. What's this? Oh, this was the play you saw?
Yeah.
Let's bring that home too. We can talk about it.
Okay.
Do you want to bring your fidget?
Yes, please.
Okay. All right. Anything else you're going to need for the next 5 weeks?
I'm assuming you guys have a glasses cleaner.
Yes.
At home. Yeah.
All right. I can't get the timer out of here because of the way the bed is, so we'll just bring the fan home, and we have other timers at home.
Do I have do you have an extra mouthwash at home?
Yeah, you have mouthwash at home. So this will be recycling, and then we'll deal with the recycling and garbage generally. All right. What about this desk? What's coming home over here?
Actually, before we do that.
All the condoms.
Yes.
What are we doing with all the condoms? What is a rubber ducky for? Oh, that's just something
that's-
cute.
yeah.
I thought it was sexual. Because you have all the condoms.
Yeah.
I saw you on the Raw flyer. They had their RHA flyer of all the events from this semester. You're in like every picture.
Yay!
There's a picture of you at Condom Bingo up at the table. I guess just leave these here, right? You're more likely to use them here than at home. Let's hope you don't use them. But I mean,
Hey, Anakin.
What's up, Ben?
Doing well. How are you?
Good, but how are you?
Pretty good. Yeah. When are you leaving for winter break soon?
Next week, yeah.
Oh, next week. Okay.
Yeah.
Cool.
What about you, bro?
I'm leaving today. Yeah.
Oh, that's not cool, bro. You
Yeah.
do anything fun?
We are going to the beach for a week. Okay.
he had a medication-resistant epilepsy that medication would never fix. So it would be symptom management, but it would not prevent his brain from seizing altogether. So based on the literature that was out there, we knew that surgery was the only chance he had at seizure freedom medication. We tried 4 different epileptic drugs. I mean, I think brain surgery, it is the most invasive possible surgery you can have. We reached out to UCLA, and they wouldn't do the surgery because he was too small. As soon as we got to Boston, and this was just a week later, they said he is having full-blown infantile spasms. We see them on the EEG. It's very evident he's absolutely a candidate for surgery. And they were willing to do the surgery, but it wasn't a right fit at the time. And then we ended up going to Cleveland Clinic, and that surgeon said, oh my gosh, I do most of my work on this small of children. Yes, I feel very comfortable doing this.
Having 100 epileptic spells per day. Epidermal nevus syndrome on the right side is something that's often associated with a disease or with a condition of the brain called hemimegalencephaly. It's a big word, means that half the brain is enlarged compared to the other half. And not only enlarged, but not formed right, and is associated with intractable epilepsy. If left 100 seizures a day, if left untreated, is really not compatible with life. We put them on anticonvulsant seizure medicines, 1 medicine or 2 medicines, and still they're having 100 seizures a day. That's a patient that's going to need to have surgery, and surgery soon, because of the life-threatening status associated with that kind of epilepsy. So he has 100 spells where he just spasms and jerks. It's not the shaking, fall down, foaming at the mouth, biting their tongue seizures that the public, kind of associates with epilepsy. It's not that. It's just very subtle spasms and drops all day long. But what it does is it's kind of like your cell phone that would be maybe a little damaged by the water, and it's constantly resetting. You're not able to really do much with it. One of the biggest heartbreaking things that I see in patients who have uncontrolled epilepsy is this cognitive decline because of untreated epilepsy, where their brain just doesn't develop. And when the brain doesn't develop, they're not speaking, they're not going to school, they're not independent. I don't have one test I can do that says this is where the epilepsy comes from. Parents want to do what's best for their poor child who's seizing all the time. We talked to them about 2 options. We can remove that tissue and see how he does, right? If it works, it's going to spare him additional weakness. And if I can make a cut behind that motor area, Zakiah possibly could have some spared function and not be as significantly affected from a weakness standpoint. The second option is typically a whole half of the brain, a hemispheric, half the brain issue. Some people say, if we're going to put my child through a brain surgery that's a significant surgery, let's do the one that's going to give him the best chance to be seizure-free, which of course I think is the hemispherectomy option. And Zakiah at 6 kilograms has about 480 cc's of blood, or half a Pepsi bottle in his body. And so, you can very easily lose that blood volume. One of the biggest surgical risks is blood loss. Blood loss can come, and usually does, unexpectedly and suddenly, and you have to be ready to deal with it. Hey, this surgery, if we have catastrophic blood loss, your child could die in the operating room. That's very, very uncommon, but is a risk. So these small babies, they can get very cold very quickly, and that doesn't help coagulation. And so keeping them warm, avoiding blood loss is the main goals, because my job is to get them through surgery safely. we would take out half his brain. And that would be a big empty space on this side. Nobody signs up for Parenthood to have their child's brain removed. There's a reluctance to do it. But at the same time, when they're here, they realize it's the only way, that medicines aren't working. Parents experience guilt, because they have to make this decision. Is it the right decision? What do I do? So it's an emotional roller coaster. I'll meet the patient in the office briefly, talking with them, and then we see them the day of surgery in the morning before surgery, where we go over all the details. We huddle with the parents and the patient, and we mark the side of surgery, and we have a safety discussion where we go over all the different things, allergies, etc., make sure everybody's on the same page, and then the pediatric anesthesiologist will take them to the operating room. It takes them a while, maybe an hour, to get everything in. We have a catheter in his artery, we have in his wrist, we have some IVs in his arms, we'll have a catheter in his bladder, we'll position his head, mark out the incision, clip a little bit of hair. So, and that all takes maybe an hour, hour and a half to get started. Child's asleep for 5 or 6 hours in the operating room. The actual surgical part is maybe 4 hours, maybe a little less than that. This kid is 12 pounds. He's a tiny human being. So small brains, they're new. And so just like a new car, there's no scarring, there's no damage, there's no rust to worry about as we get in there. And so the skull is very thin. It is probably a little smaller than a human brain. A pediatric brain this size. And we're taking out the temporal lobe, the occipital lobe, and part of the parietal lobe. And we're leaving this big slab of frontal lobe in place. We do epilepsy dissection using sort of a subpial technique. The pia is it's like a translucent membrane that covers the brain that has the blood vessels in it. When you open that and you get into the brain itself, there's gray matter, there's white matter, and the white matter's white and the gray matter is kind of this grayish brown color, and it's suckable, so we can use a kind of a hand-controlled suction device and a coagulator to remove it. It's something you could very easily put your finger into, a little bit like gelatin. I physically remove the temporal occipital lobe and then a portion of the parietal lobe. In Zakai's case, when the brain's exposed, I can put electrodes into the brain and measure the EEG. We could hear bad electrical activity, we could see it on the EEG, but it was diffuse everywhere. Unfortunately, in his case, his entire hemisphere showed this epileptic pattern. During surgery, recording from the brain itself wasn't very helpful. The idea was to remove that abnormal tissue, and so that's what we did. In his case, it was pretty clear in the sense that temporal lobe, occipital lobe, parietal lobe was the most abnormal. Fortunately, we didn't have any great surprises. So we fill it up with some saline, some sterile saline. We want to make sure there's no bleeding. We close the covering of the brain. We put the skull back in place, and then we sew the skin up over a drain and wrap up his head. When seizures happen after surgery, it's kind of everybody's worst nightmare because the goal of the surgery is to stop the seizures. Zakai was even more challenged because he had a flurry of seizures in the first day or two afterwards, and then they stopped, and they fortunately stopped for 6 years. Epilepsy surgery, long-term outcome, 10 years later after surgery, about 55 to 60% are seizure-free.
Despite the fact that we were wary of subjecting him to another resective surgery, it was just so compelling how discrete, how focused his area of seizure activity was, that was the tipping point for us. We thought he was a good candidate for this. So Zakayo, and his brain is now remodeled into a three-dimensional object. So I've given us some X-ray vision where we can fly around his brain and slowly peel away the layers of tissue so that we can see the anatomy underneath, and you can see the very large resection that he's had. But the area of interest now was in the frontal lobe, and so we were able to color that ahead of time and put a sheet of electrodes down, and in the center of our grid of electrodes is where his seizure activity was. So that's how we pinpointed what needed to come out.
Another turn?
Yeah,
I think it does, but you still have to take this turn first. So let's see. Can you read that? I know it's kind of tough.
Waters quicken, begin to swirl.
So Zakayo has a cochlear implant on the right side of his head, and this is the external processor, which has a microphone, so it receives sounds, and then it sends those sounds into his implant, which is a spiral into his cochlea. It's an electrode, and then he's able to process sound. So he can hear in his right ear now with the help of this little device. He is hearing in his left ear at the moment, yes. So he only lost hearing in his one ear, and that was spontaneous. No one really knows why.
Ready? Go to it. I don't have time to get my hand in it because it's going by so fast.
Zakayo runs. Zakayo holds. Zakayo scores. 1, 2, 3, 4, 5. Jumping up and down on the bed, or sitting up a stupid song, or telling one of your pointless stories.
Happy Brain Day to you. Happy Brain Day to you. Happy Brain Day, dear Zakayo. Happy Brain Day to you. Woo! 1, 2. Woo!